Hello everyone, this is Nivedita and you all are welcome to NG's Corner for Nurses. Hope all of you are doing well. In this video, we will discuss about the breath sounds and in this part, we will focus on normal breath sounds. Are you ready? Then let's start today's session. This is the outline of today's session. What are breath sounds? These are the sounds that come from the lungs during inhalation and exhalation that can be heard during auscultation. Now the question comes, what is auscultation? Auscultation is a simple non-invasive procedure that involves the use of stethoscope to listen to the sounds produced by the body. And for the sake of this video, we are specially focusing on lungs. So here we will talk about the lung sounds. So next, coming to the related anatomy. Lungs are two voluminous cone-shaped organs occupying most of the thoracic cavity, and it is covered by a serous sac which is known as pleura. The right lung is divided into three main lobes, which are separated by the oblique and horizontal fissures. And these lobes are superior, middle and inferior lobes. The left lung is separated by the oblique fissure into two main lobes, the superior and inferior lobe. The bronchial tree is a branching system of air passages in the lungs, starting with the trachea and ending in small bronchioles and alveoli. It functions to conduct air from the upper airways to the lungs for gas exchange. The bronchial tree structure includes the trachea, bronchi, bronchioles and alveoli. Trachea is the primary airway that extends from the larynx into the chest cavity. It is supported by C-shaped rings of cartilage to maintain airway patency. Next is bronchi. The trachea divides into two main bronchi, right and left, which further branches into smaller bronchi. And these bronchi are also supported by cartilage and lined with mucus producing cells. Next is bronchioles, smaller branches of the bronchi that lack cartilage but contains smooth muscle for airflow regulation. The epithelium transitions from ciliated pseudostratified columnar to simple cuboidal. Next is terminal bronchioles, the smallest bronchioles that lead to the respiratory bronchioles and alveoli. Respiratory bronchioles, these mark the transition from conducting airways to gas exchange. Alveoli are located along their walls, allowing some gas exchange to occur. And the last part is alveoli, the terminal units of the respiratory tree where gas exchange between air and blood takes place. They are lined with type 1 pneumocytes for gas exchange and type 2 pneumocytes for surfactant production. So where to listen lung sounds or breath sounds, whatever we say. For auscultating patients' lung sounds, we have to place stethoscope at particular areas on each side of the patient chest wall and back. So these are the locations for auscultating lung sounds. We can divide the breath sounds in two broad classifications: normal breath sounds and adventitious breath sounds. First is normal breath sounds. The pattern of normal breath sounds are created by the effect of body structures on air moving through airways. In addition to their location, breath sounds are described by duration, intensity, pitch and timing. Next is adventitious breath sounds. These are abnormal breath sounds or abnormal lung sounds. These are commonly associated with wide array of lung and heart conditions. The type, duration, location, and intensity of each adventitious breath sounds helps to diagnose and treat medical conditions. In this video, we will talk about the normal breath sound, and in coming video, we will describe the adventitious breath sounds. Normal breath sounds or normal lung sounds can be of three types: bronchial, bronchovesicular, and vesicular. Let's learn each types in details. Bronchial breath sounds are loud and high pitched with hollow quality. Inspiration is slightly shorter than expiration. You can see in the graph, and there is a slight pause between inspiratory and expiratory phase. It can be heard over the tracheal area, and it is created by air moving through trachea close to the chest wall. Now listen the bronchial breath sounds carefully. Bronchovesicular sounds are the blowing sounds that are medium pitched and of medium intensity. And you can see in the graph the inspiratory phase is equal to expiratory phase. It can be heard posteriorly between scapula and anteriorly over bronchioles lateral to sternum at first and second intercostal spaces, and it is created by air moving through large airways. Now listen the bronchovesicular breath sounds carefully. Vesicular breath sounds are soft, breezy, and low pitched. Here we can see in the graph, inspiratory phase is 3 times longer than expiratory phase. It is best heard over lungs periphery except over scapula, and it is created by air moving through smaller airways. Now listen the vesicular breath sounds carefully. Next part of this topic, that means adventitious breath sounds, will coming soon. If this content is useful for you, then please put a like and share it with others. And for getting more videos like this, you can subscribe my YouTube channel NG's Corner for nurses. And for any queries or for any suggestions, you are most welcome to comment. Thank you for listening.